Hello, hello. This is the A to Z dentistry series, and today we are focusing on the letter M. M stands for Maryland Bridge. So, the background to this is that Maryland Bridge is less invasive and is very important for those who are very conscious or the psychological impact of losing a front tooth. We know when you lose a front tooth, you are not able to smile. So for the purpose of this webinar, we're going to focus on Mary, who has lost a front tooth, so which is a central incisor. So we'll focus on the upper right central incisor. The project goals are to talk about what is a Maryland bridge, how knowledge can help, and part of a Maryland bridge. So what is a Maryland bridge? This is where the discussion is going to, as I said earlier on, we're going to talk about Mary, a case study, who has lost a front incisal tooth and went to the dentist for a quick fix. So what is a Maryland bridge? A Maryland bridge is a bridge that replaces a tooth. It's ideal for the front. It is a type of minimally invasive bridge which replaces a tooth with wings on the side. So the wings could be metal or could be ceramic. So the wings will be behind the other teeth that are joining the missing tooth. So if, for example, it's your right central incisor that is missing, the right central incisor, which is the pontic, that is the tooth that is missing. Now the question you ask yourself, how is this bridge going to be able to stay in my mouth? So that is when you have wings that is attached to the left and the right of the missing gap. So if, for example, it is the tooth that is missing central incisor, then the tooth that is going to add to support it will be the lateral on the right, and then the other central incisor on the left. Prevention is always better than cure. So before you do a Maryland bridge, you need to take a shade. You have to choose a color. The only disadvantage about Maryland bridge is that it debonds. Debonds means that because you're using only cement, or another word I use is a sticky bridge, because you are using just cement to stick it to behind the other teeth to anchor it in. After some time, the cement may weaken and the bridge may come up. The reason why it is suitable for the front is because if you don't put too much pressure on the front, you don't bite into hard stuff and things like that, the longer it will last. And one of the advantages is minimally invasive. You don't have to drill any tooth tissue to be able to replace it. And the aesthetics is fine. So you can choose the color. So for example, if Mary has lost a central incisor, she goes to the dentist. The dentist doesn't need to do any prep because we want to conserve more tooth tissue. You choose a color. I get the patient involved in choosing the color. You take the impression, send it to the lab. The next time you come in, we cement it in with a special cement and then teach you how to keep it clean. So that is what a Maryland bridge is, or sticky bridge. So it is a bridge that replaces a tooth but has got an extension to the side. The extensions are called wings, and the wings could be a metal or it could be ceramic. And it gives you a confident smile. And no one can tell the difference unless you look at the back of your teeth. Then you can see the wings. And the result is it increases your confidence. You're able to replace your tooth quickly. It is minimally invasive. It's pain-free. So that is brilliant. Thank you for staying on and share the knowledge. And see you in the next video. Thank you for coming along. I hope you've enjoyed listening to this from Maryland.